most common myths. We're joined by fertility expert Dr. Lynn Burmaster. Welcome back, Lynn.
Good morning.
Okay, so I've heard about this. We heard about this from our doctors, that if you've been on the pill for a long time, you need to come off because it could take a while to conceive. You're shaking your head.
That is not true. So as soon as you come off the pill, the hormones are out of your system within a few days, and you can get pregnant almost that month, or you should be able to get pregnant that month. If your periods are not regular after stopping the pill for a few months, then you should see your fertility doctor or your general practitioner, because there may be a hormonal problem that's causing your periods not to be regular.
What about coffee reducing fertility and being linked to miscarriage?
Well, there is some evidence that having more than 5 cups of coffee a day can reduce your fertility and also cause miscarriages. So I usually tell my patients to cut down their coffee to 1 to 2 cups a day.
Right.
What about the cough syrup myth? Like, if you drink it, you're going to get pregnant.
I've never heard that one before.
Well, that comes because cough syrup loosens up the mucus in your lungs. So the theory is it loosens up your cervix mucus, but there's no truth behind it.
Oh, really?
So
Okay.
cough syrup will not help
We
you
are
get pregnant.
mixing the myths here.
That's it. That one's gone. Now, what about women can't get pregnant while breastfeeding?
Well, that's not true. That's a common mistake, because a lot of women think that, and all of a sudden, oopsie, they're pregnant again.
Yeah.
So the chance of getting pregnant while you're breastfeeding in the first 6 months is 1 to 2%.
Why do we think that it is true? Why do we think that we can't get pregnant if we're breastfeeding?
Because it often stops your periods, but you will sometimes have an ovulation whilst you're breastfeeding.
Right, okay.
All right, let's get on to the boys. Like, okay, we said Jonesy in here, motorbike rider. So if you ride bikes or motorbikes or anything like that, that's gonna hamper the twins and you can't conceive.
Well, what happens, bike riding can squish the testicles onto the seat.
Testicles, if you
and
want to say.
and then that overheats the testicles. And
Overheat the testicles.
Overheating the testicles is not good, and that slows down the sperm.
I think I'm sweating just thinking about my overheated testicles.
So guys,
should
don't...
How
stand
many
up.
times can we say overheated testicles?
Stand up, David. you need
Walk
to
this
cool
out for a
down.
second. Oh, I just dropped something. I think it's... Oh, no, it's my mics. Oh, good, thank goodness for that. I panicked.
Now, Dr. Lynn, having sex just before you ovulate increases your chances of having a girl.
Not true.
Oh, I can't get any of these right.
So that comes from the theory that girls' sperm swims slower than boys' sperm. So boys' sperm is much faster, but if you have sex 2 days before you ovulate, the boy's sperm is still sitting there waiting for the egg.
Is it true that girls' sperm is smarter than boys' sperm?
Yes, I think so. We've studied that.
Yeah.
Okay, how about drinking Coca-Cola and just eating meat, and then you get men?
Yeah, well, that's sort of a macho theory, but that's not true either. So just eating lots of red meat and drinking Coke won't make boys. No.
Okay. What about this one? So if you lift your legs in the air for 20 minutes after intercourse, it helps to achieve
What if you
a
stand on your
pregnancy.
head?
No, that's not true either. So what happens when the man ejaculates, millions and millions of sperm goes into the vagina, and the cervix mucus attracts the sperm up through the canal. So
It
and
can't
into
come
the
back.
No.
Sometimes it does, though.
No, straight up the canal. So, yeah.
That was too much information, wasn't it? All right.
Okay, the most...
You all know what I'm talking about. Don't pretend you don't know.
No, that's just...
Why do I look at an earache with you?
That's just other fluids you don't want out there.
I know.
I feel like we're doing here, like...
If we'd only picked 2 more mature hosts to do this segment with you, Dr. Lynn,
What about when your most fertile day is when your temperature rises?
Not true either. You've missed it by that stage.
Oh, you've missed it?
You've missed it. You've got to have sex before your temperature rises.
So that goes up after
So
you
close
Yeah.
with
ovulate.
the thermometer in,
That's right.
checking that out.
That's right.
Honey, I'm cold. Let's warm me up.
That's
So
right.
how do you increase your chances of falling pregnant?
By having more sex. So if you have...
We're trying to do this seriously, and you guys...
So basically, if you want to have a baby, you need to have sex.
You've got more chance of catching ovulation if you have more sex. So, and also it clears out the men's old bad sperm. So if you have sex...
All right,
I have sometimes, like, it's been a while, just like old men's sperm. Just like, no, I'm too tired.
This is my question from before. So, Dr. Lynn, you say have more sex. So how many times should you have sex whilst you're ovulating in order
Well,
for...
How many times a week?
You should be having sex every second day from about
what
day
if
to
you're
I thought you were going to
tired?
say every second hour for a second.
Well, there's always pills if you're tired to take, so ask your doctor for some pills. No, but no.
That's awesome.
Every second day is probably ideal. So, and that helps. That helps the sperm rejuvenate, and it also helps the lining of the uterus attach or be ready for an embryo created from your partner's sperm.
Does
as
it
well.
really?
Yeah, so being exposed to your partner's sperm regularly helps the uterine lining accept an embryo.
Wow,
Yeah.
didn't know that.
There you go. Well, basically, also as well, I mean, we've been having a bit of laugh about it because it is funny to talk about this time of the morning, but in all seriousness, there are people out there who might be having trouble with it. If they are having serious trouble, if they're doing all of these things,
That's right.
they should come see somebody like you.
Yes, that's right. They should see their general practitioner first and make sure that they are ovulating and their partner's sperm is normal. And then if everything sort of seems normal in that department, they should be coming to see us.
But don't forget, everybody out there, you've only got 2 more weeks to hit the baby bump.
That's right.
So take on some of my tips and
Get busy.
Get busy tonight.
Take on the tips.
Thank you, Dr. Lynn.
No worries.
Very interesting.
Thank you, Dr. Lynn. You're the
We've
best.
revealed
Come back
far
soon.
too much in that segment.
My legs are really tightly crossed after that testicle thing. Anyway.